Here are the things that you need to know about your cats and the current coronavirus pandemic. 2 house cats in New York State are the first in the U.S. to test positive for the coronavirus that causes COVID-19, the Centers for Disease Control and Prevention announced on April 22. The owner of one of the cats had been diagnosed with the disease, but no one in the household of the second cat had tested positive, so it's not yet known how the cat contracted the virus. Both cats had mild respiratory symptoms and are expected to recover. Experts say it's important to know that cases of pet cats acquiring coronavirus are very rare. In the world, there are only 3 confirmed cases of domestic cats, and 2 confirmed cases of dogs getting sick. The CDC says there is no evidence at this time that the disease could spread in the opposite direction, from pets to humans. However, one recent study, from a veterinary diagnostic lab in Maine, tested thousands of samples from dogs and cats, and found no cases of the disease. While an early version of a report on a small experiment testing whether the virus could spread between cats, found that indeed it can. Although the research does not suggest that cats are a vector in spreading the disease among humans. Hello. This video is sponsored by BMX Pets. Are you looking for high-quality cat collars at an affordable cost? Check out bmxpets.com. Use coupon code KittenLife to get 20% off. With more than 2.6 million cases of COVID-19 globally, experts say that if pets were a significant vector, we'd know by now. Many pet owners are more worried about getting their animals sick than they are about contracting illness from their pets. To keep your pets healthy, treat them as you would any family member. If someone in your house is sick, they should isolate themselves. Make sure your pet maintains social distancing. The CDC recommends that pets should not interact with anyone outside your household. When strolling your cat, stay 6 feet away from other people and animals. It's a good idea to avoid public parks. Experts recommend washing your hands before and after interacting with a random cat, just as you would with a fellow human. Both wild and domestic cats had been known to be susceptible to feline coronavirus, a different strain. But until recently, it was unknown whether they could contract SARS-CoV-2, the coronavirus that causes COVID-19. It's believed that the SARS-CoV-2 strain of the virus developed from a closely related coronavirus in bats. Researchers theorize that the strain evolved and jumped to an intermediate host animal, and then evolved again to infect humans. Scientists have been working quickly to determine what other species are susceptible to infection. Initial studies are working to identify any animal that the coronavirus could infect, whether or not it causes illness in that species. Among the species scientists are studying are cats and ferrets, both of which appear to be at least somewhat vulnerable to infection in laboratory settings. Virologists are cautioning us that although the pathogen can enter the cells of some species in a lab, such infection might not occur outside of a laboratory setting. They have also determined that animals infected in a lab might not become sick. Additional testing will be needed to develop a better understanding of how this develops in animals. What virologists concluded though is that cats have also contracted the virus from humans, but there are no reports of a person becoming infected with the virus from a cat. But experts suggest that the possibility deserves more research. The researchers urged people not to forego the comforts of feline companionship. Humans are the clear dangers in terms of disease transmission, not pets. If someone with a cat has the virus, Dr. Halfman of the University of Wisconsin-Madison said to use common sense. No cat kisses. The Centers for Disease Control and Prevention as well as other organizations suggest keeping pets away from humans who have tested positive. The results suggest that cats should be considered an element in the effort to control COVID-19, but that they're not a major factor in the spread of the disease, says Dirk Pfeiffer, an epidemiologist at the City University of Hong Kong. The focus in the control of COVID-19 therefore needs to remain firmly on reducing the risk of human-to-human transmission. However, because all animals can carry germs that can make people sick, it's always a good idea to practice healthy habits around pets and other animals. Here are some precautionary measures that you could do to help prevent the spreading of COVID-19. 1. Always wash your hands after handling animals, their food, waste, or supplies. 2. Practice good pet hygiene and clean up after pets properly. 3. Talk to your veterinarian if you have questions about your pet's health. 4. Be aware that children under 5 years of age, people with weakened immune systems, and older adults are more likely to get sick from germs that some animals can carry. If you are sick with COVID-19, and your pet becomes sick, do not take your pet to the veterinary clinic yourself. Call your veterinarian and let them know you have been sick with COVID-19. Some veterinarians may offer telemedicine consultations, or other plans for seeing sick pets. Your veterinarian can evaluate your pet and determine the next steps for your pet's treatment and care. When possible, have another member of your household care for your pets while you are sick. Avoid contact with your pet, including petting, snuggling, being kissed or licked, sharing food, and sleeping in the same bed. If you must care for your pet, or be around animals while you are sick, wear a mask and wash your hands before and after you interact with them. Knowing all of these will greatly improve our chances of beating COVID-19. If this video was helpful, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.